ClinHaem Haematology Demystified.
Hey, welcome everyone. So as I mentioned, we will just today be doing a relaxed session on the FRCPATH Part 1 exam itself and any queries relating to it and how to prepare for the exam. So I would suggest some preparation strategies and we'll try to explain how in theme series that we are doing will hopefully help towards your preparation. And then we will focus on feedback for a recent mock exam that some of you would have done. And then we will take questions from yourself. So for most of you, the first part might be familiar already, but you might be here mainly for the feedback, which is at the end. But this is an introductory session, and some colleagues are here who are not part of the series yet. So I thought it would be good to just give them an overview about the exam and the course itself. So I'm quickly starting with the exam. FRCPAT Part 1 exam is just another exam, but I would say this is probably not as hard as the other exams that we have done, after reaching here. So MRCP and all those exams were much harder because their syllabus is quite broad. And this is a specialty that we work with every day. So you shouldn't um, so the learning actually helps directly because some other exams you're learning, but you never apply that knowledge. But here you can actually apply, so that's pretty good. It's not wasted, you're learning. And so that's why I suggest we take it as another exam, relax, but not too not be too relaxed. Actually have a bit of a plan with some strategy and stay focused as with any exam to do well in that. Why do you need to take part one exam? It's quite a it's quite a good exam because hematology is quite concept and reading based. So you have to stay up to date not only with the concepts but also with the management. So learning towards learning hematology, trying to prepare for the exam actually directly should lead to improved patient care, which is at the core of what we do. And it boosts your confidence as well. So hematology is quite niche, so most of us would not have had a lot of experience in hematology before entering hematology. So our confidence levels are quite low. We feel like a medical student again, but learning towards the exam would hopefully help towards that. It's a globally recognized qualification, in which is quite, this is very, very important, especially sometimes if people are actually planning to apply for or work internationally. So this exam does help you towards that. For IMGs, this can be a pathway to their GMC registration. Actually, of course, there are other requirements like language competency skills and things like that. But there is a route to get your GMC registered through the FRC Path exam itself while you are not working here. And of course, this exam, builds a strong foundation for your Part 2 exam, which is coming next. So there is a common misconception that people will say, "Oh, I'm preparing for Part 1. I'll start Part 2 in a year or whatever." That's actually absolutely false. When you're preparing for Part 1, you're actually preparing for Part 2 as well. It's the same knowledge that they're going to test, but they're going to add morphology and things in there. So it's no separate preparation. It's just the same, but you test it in different areas and by different ways. And of course, if you want to work as a consultant, it's an essential step. So you don't have a choice. If you want to work as a consultant, you have to take these two exams. And this short clip I've shown almost everywhere now. You probably get bored with this, but I will show that again. And hopefully the sound works as well, but you get the message even without the sound. Now, yes. So, any exam to do with medicine is important. Once we entered medicine, this should be at the core of what we do, why we learn, why we come to work and things, because it's a huge responsibility. And at the end of the day, a person's life does literally depend on what you know and what you don't know. Of course, there would be help around, more experienced colleagues around, and you're never on your own. But ultimately, if you know your stuff, you would definitely help save patient lives. Literally, you save lives. So that is very important when preparing towards anything or reading in journal. Now, what is the exam itself? So it's an online exam that evaluates your knowledge and clinical judgment in areas, in important areas within the hematology training curriculum. So if you just Google that, this is how it looks like. It's like a quite detailed PDF, and at the end, it actually tells you which topics they are going to test you in, which basically is the entire hematology, and this is the syllabus. But the problem is they list you a lot of topics, and they will test you against the British/international standards. But we don't, the one of the main problem is where to study what from. If there's a guideline, that's fine, makes sense. You do the guideline. But if there's a topic that's listed in the syllabus, but there's no guideline, it takes a lot of effort to try to find out where to study it from, and is that actually relevant for UK practice or not. So that's quite challenging. There are around 125 BSH guidelines at the moment, but they do not cover all topics. And there are the resources like ISTH guidelines for thrombosis, for example, or other society, other British society guidelines like RCOG for hemops, and of course there are textbooks as well. And it can get quite complicated and quite overwhelming to know where to study what from, and that's where we hopefully try to help you with, because we've been through this process, and I know where you need to know your particular topic from. So it saves a lot of effort and hard work, just by knowing that, if there is some guidance and structure to that, which we hopefully provide. And of course, there are two papers, paper one and paper two. Both papers have equal representation from the following subspecialties, which is transfusion, general heme, including lab management, hemato-oncology, and hemostasis and thrombosis. The problem with our training, mostly in the UK, is that we are basically working in number three. So we are basically 95% of the work that we do is actually hemato-oncology, but in the exam, it's only 25% of your, of your, grading. But to be actually a competent hematologist, you need to be good with the other specialties, of course, as well. And that's why they reflect that in the exam. And some colleagues, what they would do is they would spend ages on trying to cover hemato-oncology. And this is by far, if you see the guidelines, the majority of guidelines on hemato-oncology, if you spend ages on that, so say 5 months of your 6 months practice on that, which hopefully nobody would do, but if you do, then you're left with a month for the rest of the stuff, but you've only done 25% of the exam. So that's a very common mistake that people do. Some other people may like, say, they're a HNT person, so they like hemostasis and thrombosis. They might spend their time just in hemostasis and thrombosis, but then they will miss out. So for this exam, you actually need to know a little bit about everything, then everything about a little bit. And that's the key. And how the exams are structured is all in the website. So paper one is long essays, which has 4 questions, and the duration for the exam is 3 hours. And paper two is MCQs and EMQs. So MCQs from the best of five options, and EMQs again. So they will list say 10 or 15 options, and they'll give you 5 or so scenarios or questions, and you have to match to the right answer. And this is again 3 hours as well in total. They're usually 50 MCQs and 75 EMQs, so a total of 15 EMQ questions. Sometimes they do change it a bit, but that's the standard, and that's what they mention on their website as well. And how to prepare is the question. So first question, of course, everybody would think is when to start the preparation. I would say if you have entered hematology, you should start preparation there and then. Maybe you do it more intensely when it's maybe up to 6 months or 4 months before the exam, depending on your circumstances. So if you are in a less busy job or a rotation, you would maybe 4 to 5 months is okay. But if you're in a busy job, then at least give yourself 6 months as a minimum to, so that you are relaxed with the preparation. Hmm. So once you're in ST3 or in year one of your training, you start your preparation. That's the golden rule. But one to attempt an exam is a different question. So you need to have worked in hematology for a bit before you should actually attempt the exam. Now on the website would say up to 1 to 2 years of hematology training, at least 1 year of hematology training is the minimum requirement. And when you are actually applying for the exam, they ask your supervisor to, sign a form to say you are actually at the right stage to take your exam, and that might depend on yourself and how your supervisor judges you as well. Maybe they say you are okay to do that, then you're not okay to, even though you've got 1.5 year in, in training. But as a minimum, you do need at least 1.5 year, I would say, before you should attempt the exam. So maybe when mid ST4 and ST4 is a good time. Because most of the exam and the learning towards your exam would actually come from your day-to-day work. Of course, there would be rare stuff that you would hardly see, but the long essays and things are usually mainstream topics. So you do, what you would remember at the end of the day is what you've actually done. So if you keep memorizing stuff, that's usually doesn't consolidate your memory. But if you've seen that and managed it yourself, you'll basically just be copy pasting your answer as your management plan when you saw the patient. So ST4, mid ST4 is a really good idea to start thinking about attempting the exam at that time. How to prepare? So I would suggest there are, as with any long essay, you have to divide it into general management and specific management, as I keep saying. So I'll try to do that for this question as well. So I'll give you some journal tips and then mention some things exam specific. So these are just journal for any exam, but specifically this exam. So you learn on the job, as I've said. Whenever you are going, you're going to say a lymphoma rotation or myeloid rotation or whatever. During that rotation, maybe when you are in ST3, you should try to say, okay, I would try to go through all the guidelines that there are maybe before the rotation if you're really good, or at least during the rotation, so that once you're done with the rotation, those guidelines very well. And once you see those guidelines in action, hopefully when you're seeing those patients, that will consolidate your memory quite nicely. And when you see your patients in clinic or on your ward rounds and afterwards, you just refer to the guidelines again and see how they fit in. But of course, as I say, rare illnesses and rare concepts you would hardly see, so you do have to, study for them. But you study smart. What you do is, it's the problem with this is that some people would stick to textbooks. Now the problem is, thankfully, actually, there's a new, as I've mentioned previously, the most common textbook used here in the UK is Hoffman's postgraduate hematology, and it's smaller essentials version. So the good news is that both of them have had a relatively recent editions published within the last 12 months. So they're pretty up to date. But the problem is after a year or so, they quickly go out of date because key things keep, developing. So what you need to ideally have is for each illness, for each at least the main illnesses, you need to have your own um, material to refer to. So some people have guided guidelines, so say like a PDF copy of a BSH guideline, and they just make all their notes on there. You can easily edit a PDF and all the add your notes on there, whatever you learn about that topic, and then it builds your own the resource. And at the end of the day, you don't need to go through all the guideline again because there's a photographic memory that's developed. And once you write, you actually remember as well, and you have to know they're going to test you on. So as I've mentioned, have a quick skim through the hematology curriculum to see what they actually want. And the RCPATH website, it's like a half a page, and it actually tells you what questions to expect and how they expect you to to be asked about them. So for example, of course they will ask you about a clinical case management and things, but they can ask you, say, about designing a pathway for GP practice or your local GP surgeries for, say, raised ferritin or something else like more common like raised eosinophil. So devise like a pathway or a guideline for your local team or your local region. So they do say, and they can ask you about laboratory management and things as well. This exam is 40% practice as any exam, but the problem is this is an online exam, so you have to type. So some people are not in the habit of typing, so you do need to practice exactly how you are going to attempt the exams as online and typing. So for some of us, it's easy because all the electronic record or the patient record is now online, and you keep typing all your day and night, so that's okay. But still, for others, especially if you're struggling with typing, you need to practice on that. There's a very important point that RCPath colleges actually allows you to have some adjustments as per your needs. So say if somebody has eye problems, they might give them extra breaks or extra time. And so if you have any such problem that's interfering, with your exam preparation or practice or in journal, it is worth mentioning when you book an exam, they actually ask you if you have any reasonable adjustments, please write to us. So write to them as soon as possible. They might ask you like a few documents to confirm which you have said, but they are really generous with giving extra time and accommodating you to the best of their ability. So I've never had any problem about a colleague who's trying to ask for adjustments and they've been declined. They've hardly ever declined any request as long as you can prove what you are struggling with. So in the exam, this is the most important, and if this is what you take away, that's good enough. You read the question carefully and stay to the point, because some people would be quick in the rush, actually, in the heat of the moment. You read the question and you think it's asking about something, but it's actually asking about something else, and you are on a totally different train and you have to stay to the point. So for example, if they ask you how to diagnose PNH, you don't say PNH is caused by this and that. The answer sheet wouldn't allow that. So I'll show you at the end our mock exam, and I've made a mock, I made a answer marking sheet as well. So I'll show you how it works. So they would just mark you by what is in the marking sheet that's been agreed. So they don't care if you mention everything else or all the wonders about PNH if you not address the how you diagnose it and what's exactly in their mark sheet, which they think is the reasonable answer, then they wouldn't give you the score for that, because it's not. They try to keep it objective, so they want what is actually they want what they have in their answer sheet. So you have to actually guess the examiner's mind, or you have to try to guess what they are asking you. And what would be in the answer sheet, and try to replicate that. Be time and questions aware. So especially for the long essays, you can quickly scan the whole essay paper first. And then what will happen, it will take 2 minutes or so, a half a minute or a minute, quickly scanning them. Then you will know, okay, first question is about IHA, second is about the hemolytic disease of fetus and newborn, and third is CMML, and fourth is sickle cell disease or something like that. So you would know which questions you know well. So you can start with them first, maybe, and then you do them, but don't, because you won't spend too much time on them. You know them, and you will quickly list them in bullet points, in nice headings and things. And meanwhile, at the back of your mind, you'll be thinking about those questions which are bothering you. But once you come to them, then you have good time to try to answer them. But again, you do not leave anything blank. It will be impossible for you to leave anything blank after having been in hematology for 1 year. You wouldn't, unless you're very tired and you're like, just leave it, I'm not bothered, that you wouldn't leave anything blank. So there is no negative marking in the exam. So don't leave anything blank. If you make a big blunder and things, they wouldn't still negatively mark you, but they might think, oh, what is this guy talking about? But they can't negatively mark you still. Make good guesses even if you don't know anything. Now, you have to give proportionate attention to the question as per the marks and the knowledge that you have. So say there is a question that is on IHA and you know autoimmune hemolysis very well, then you will spend that much time on them. So the time spent on them should hopefully be shorter than the time spent on something else which you don't know. But again, in the question stems, look at how many marks they have assigned. And I will illustrate that point through the mock answer at the end. So if they have assigned three marks for, so the question is, what is your diagnosis? And the bracket says 3 marks. So if you just write AIHA, thinking they asked for 3 marks and I've given them 4 letters, they wouldn't mark you fully, because you have to again guess. So even though they ask you what is the diagnosis, but they've said it's for 3 marks, so they expect you to justify your answer and try to explain why you reached this conclusion, etc. You just have to be careful with that. And as I say, proportionate attention as per your knowledge as well. So if you don't know the answer, attempt it at the last, so that you leave more time for that maybe. But once you know some answer, you attempt it nicely and quickly. And they give you breaks. So it's in the exam, you're sitting at your home with a laptop and your camera on, and they keep an eye on you, but you can take break. So if you are tired or whatever, you can ask for that and they will give you that. But they will explain the breaks and the mechanisms for breaks and when the breaks are allowed anyway. And there's a break in between the exam anyway. Most of all, for the preparation is a long journey, 6 months or so. So you stay motivated with the study group, because if you are not in the mood, somebody else can actually push you through, and you should enjoy him, because it's quite a nice specialty, and you do and you treat what others hardly even understand, and you will know this from your day-to-day life. People have no clue what you're talking about, and you are solving issues that they don't even know existed in ways they can't even imagine. So that's really good, actually. Now, where to study from? There are lots of resources. BSH guidelines are a must, because this anything in the BSH guideline is worthy of an exam question. But the problem is some of them they're not written thinking that you are an ST3 or starting in hematology. They're written as if you are a professor in hematology, so they won't mention what what's behind what they're saying. Some people only try to do MCQs from MCQ banks and things, which is fine, but what I found in my experience was most some the one actually the one at least the ones that I was exposed to, and even those were big names, the MCQs were not of very good quality and they were outdated many of the times. And I know that because I started doing them after having prepared for the exam, so after learning, and then I thought, okay, I'll attempt some. But that always made me uncomfortable. Like, how many? So if I know a question and that's wrong, then how about the questions that I was thinking I was doing right? So you don't just rely on the MCQs, and of course they don't help you in long essays. There are some revision courses, and some of them are really good, but again, they are only to. For example, I went to a very well recognized revision course, and actually made me more depressed at the end. So it was very near the exam, and the course was okay, but they were just discussing about all of these advances in all of these illnesses, but I had no idea about. But the recent advances do not carry the majority of the score. The majority of the score is what the illness is, how do you diagnose it, how you manage it, and how you can show that you understood a clinical problem and applied your judgment, rather than asking you what was approved yesterday for this drug. So it made me just more depressed. But for other people, they were like, okay, it helps them polish their knowledge a bit better after whatever they knew. Anyhow, I don't know where those people come from. So and then textbooks, as I've mentioned, there are textbooks, and some things you have to do from textbooks, say like neonatal hematology. So you can come up in exam in MCQs and ENQs and sometimes in long essays, but there is no guideline for that. So I mean, there are guidelines, but it's best and nicely written, say in postgraduate hematology. So I can hopefully guide you towards where to study what from, if you know what I mean. Now, and there are lots of other resources. There are quite good podcasts and video lectures, etc. And of course, it's difficult to keep track of them unless you've already been through this journey, which I have. So again, we can help you with that. Now, this is how I prepared. I'm not an MCQ only person. I like to read a topic from a textbook or an online resource to understand what it is, and what the pathogenesis is and things, and then go to the guideline and make my own notes on the guideline. So this I've done this once, say for antiphospholipid antibody syndrome. Then the next time I'm referring to it when I see a patient, I know what's happening and what's going on, what the consultants are talking about, about these tests and things, because I've been through that. And one thing actually I should mention, the exam does say they can assess you on the pathogenesis as well. So you need to know in the question stems, and of course in the MCQs, you can easily ask you about what the pathogenesis of the problem is. So you have to focus on that as well, which is missing in the BSH guidelines. For less important topics, I used quick resources like the Heme-based, which I'm sure you're aware of. If not, just Google that. It's one of the best resources for doing your exam preparation. And if I wasn't sure about a topic, I would rather use up to date or how I treat articles rather than doing a quick Google search, because Google can sometimes lead you to places where the information is not accurate, slash it's not applicable to the UK environment. It's not to say up to date and how I treat are, but at least they are quite standard international guidelines. Um, and I could have used AI for difficult concepts, but I don't think that was a big thing then. And thank God got a good score following this method. And I started preparation around 6 months before the exam. But as I say, I was studying side by side as much as I could while I was seeing patients, which is what helped me, I think, more than the preparation. And of course, there were important courses which I didn't mention here, but transfusion courses. So of course, if you're a trainee in the UK, there are three transfusion courses that they offer you. So essentials, intermediate, and the revision course. So some people would do essentials only and then take part one. Others would do essentials and intermediate and then take part one. I prefer taking essentials and intermediate, and then taking part one, because part one exam is 25% transfusion. So the essentials one does not prepare you for that, in my estimation. So what I suggest is, if you can, you take both the courses and you leave the revision course before your part two exam. So for you, you can skip all of this headache by hopefully following our series, and where I try to provide a structured plan to prepare for the exam. So what I've done is, actually I spent 3 or 4 days just going through the curriculum, sitting down, for seeing which topic is covered in a guideline or wherever, and then trying to map these into a structured program with weekly sessions, and trying to cover the entirety of hematology, finishing the course at least few weeks before the exam, so it leaves time for your self practice as well, or self preparation in things that you lack as well. And of course, we do it online, mostly on the weekends. And this recording is available for them, and all of the sessions that we do would follow BSH or slash British guidelines or NICE guidelines and things. So you don't need to go hunting for them yourself, which you are invited, you're most welcome to do so. But this could hopefully help you with cutting down a lot of that headache with your busy life. And of course, you've got a WhatsApp group with some flowers on there and the icon. I don't know if anybody has noticed, in autumn's attempt, they will be replaced by dried leaves. Anyhow, and this is the overall plan. So first, I've divided all the 4 blocks into weeks. And as you know, we are at the end of journal heme block at the moment, and this is where we are. And next week, hopefully, we start hemato-oncology and transfusion medicine afterwards, and then HNT. At and all, there are weekly sessions, and at the start of the week, as some of you would know, I send around resources for that week for you to go through, as per the schedule, which I'll show you a snapshot of. And then at the along with the mock question that you work through, and you can send me your answers. And then at the end of the week, we do a live session covering whatever was supposed to be covered in the week. And this is a snapshot for General Heme. Um, this is a snapshot for the journal heme. Oh, yeah, it's here. So this is all the topics that are important and covered in the guidelines or not covered in the guidelines. So I list them, and we are actually, as you know, here in the revision practice week at the moment, and we've covered all of them, except of course, as you know, hypereosinophilia, we decided we will cover the malignant section. And I've made similar schedules for malignant, hemostasis, thrombosis, and transfusion, dividing them into weekly lectures. And as you know, at the start of the week, this is what I send you. So say this was for week 3, I'll send you what we are going to cover, where to cover them from. So for example, for aplastic anemia, I suggested we go through the inherited bone marrow failure syndrome. Sorry, we go through the book. For adult, there's a guideline, and I sent a podcast. If you have of course, as you know, I'm very frequently send podcasts with each of the topic as well, because it helps with your commutes as well. So you can just tune in and listen. And then I send you a practice question as well, along with it, which you go through, and then you send me your answers, and I send you feedback like this. This is for a feedback for a different question that was answered quite well. So this is how the feedback looks like. I try to go through each and every word of what you have said and give you relevant feedback there. So that is all about how we are planning to do the series. Now, one question is, of course, this says spring 2026. So if you are taking the exam in spring, I think this is a good idea to join this series. But if you are planning to take it later down in the year in 2026, then it's actually even better, because then you are already, you know, planned. You're already basically more aware of what the topics are and how things work, and you're already doing more practice. Of course, more time the better. Even if you're an ST3 now, you should start doing that, I say, even if you're planning for an exam after the spring attempt, and this would actually be better for you. There's a question there, how I can compensate for previous weeks. So all of the previous weeks have been recorded, and the recordings are available. If you go to this website, it tells you how to sort it out. So clinhaem.com, and the recordings for all the previous sessions are available. So week 1 to 4 was free to access. So that's why they are on YouTube. and week afterwards they're available on paid access. But if you go to the website, there's a form to fill there, and that will, once you fill there, the information would be emailed back to you to say how to join, as you've asked, the WhatsApp group, and how to access the previous resources. So this is all about FRCPATH Part 1 and our course, and I will now move on to the mock exam. So as I said, we are in the mock exam week, and some of you have taken the mock exam, and this would be a bit of feedback on the mock exam after from here on. So if there are any questions about the exam for now, you can ask me now, otherwise we can discuss them at the end again as well. Okay, no question. Good break for me then.
Thank you for watching. Stay tuned for more.